Hello, my name is Ariana Estrella, and my topic is renal complications of hematopoietic cell transplantation. In definition, transplant of hematopoietic stem cells, HSCT, is the infusion of hematopoietic progenitor cells in patients with hematologic malignant, non-malignant, acquired, and genetic disorders of the bone marrow to reestablish immune and marrow function. The impact of the HSCT reflects on the choices of treatment, the wide diffusion of the technique, and better options to the patient.
That's another important issue because we know now that renal complications are very frequent in the patient that receive a bone marrow transplantation. We can say that probably allogeneic bone marrow transplantation is a cause of chronic kidney disease. And in this study, we were able to test the hypothesis talking about the frequency of acute kidney injury in this context and the frequency of chronic kidney disease in this context. In our study, unfortunately, we don't have a link between acute kidney injury and chronic kidney disease, probably because patients that have very severe acute kidney injury have terrible prognosis, and many of them didn't survive. But an important conclusion of our study that was that patients without any alteration in renal function before transplantation had or present during the evolution of the transplantation chronic kidney disease. And of course, this is a group of very, very, very young patients. And this is a very complicated, accurate complications and accumulate morbidity for those patients. So this is important conclusion. We need to work and try to predict the risk of chronic kidney disease before transplantations in order to avoid complications and improve survival in these patients.
In applications in medicine, HSCT may be complicated by a variety of renal disorders. AKI of different etiologies is common in the first 100 days following HSCT, incidence of 21% and 73%. Thereafter, CKD becomes increasingly prevalent. Glomerular disease and nephrotic syndrome are uncommon complications of HSCT. And pros and cons. Pros: nephrotic syndrome is rare after HSCT, occurring only in 0.4% and 6.0% of adult HSCT recipients. Given a variety of renal disorders that may cause nephrotic syndrome in HSCT recipients, and since it is impossible to diagnose these disorders on clinical grounds, nephrology consultation and renal biopsy are appropriate when this complication develops. And cons: pathologically chronic CNI nephrotoxicity is characterized by nodular preglomerular arterial hyalinosis originating in the media global and or focal segmental glomerulosclerosis and IFTA. Persistence of AKI, CKD, and proteinuria, irrespective of etiology, adversely affects long-term survival of HSCT patients.
One of the improvements I can see right now immediately is there's better coloration in my face in just a few days. As far as the kidney function, I won't know until the cells do their work for a month or 2 to 3 months. But that's, I've seen coloration and I feel good. Well, I haven't had no treatments before I come here. I went to the VA. I go to the VA medical. I'm a veteran. And they told me, and in 5-10 years, I might have to go on dialysis. So I thought I got to do something about it. And I asked the doctor there, I says, what about stem cells? She didn't know too much. She says, when the time comes, we'll look at putting you on dialysis and put you on a list for a kidney. And I didn't want that. I heard a little bit about it. I researched on the internet about it. And then I started calling. I called a few places here in Thailand. And then I got a hold of Faith, but through the internet. And she let me talk to the doctor. I talked to a couple other doctors, but when I talked to the doctor here, I can't remember his name. I'm bad at names, but he seemed very intelligent, and I'm a pretty good judge of character. And I knew what he was talking about, so I felt comfortable. This facility is phenomenal. They keep it clean. There's plenty of staff. The rooms are nice. I don't have no complaints. If I have it, there's more personal care. You know what I'm saying? More personal care. So if I had something major wrong with me, I'd rather come over here and have that problem taken care of than go to a local hospital back home where you're just another number. Everybody was professional. Everybody did a good job. So I have no complaints at all there. I tell them to get a hold of and talk to Dr. Nassar. Talk to him, let him know. I had to send my blood work. I had to send everything over here before, and he studied it. And he can study your condition. And when you're spending money on yourself, you're never wasting it. Because if you let your condition go, you can't take nothing with you. It was a positive experience.
An issue applied in Ecuador. In our country, the technique has been possible to institute it with experiences in transplantation carried by a group in a clinic in the city of Guayaquil. The complications related to the treatment are generally well managed, and advances in patient support allows to maintain a low morbidity and mortality, which makes the indication for this procedure. And in conclusion, peripheral progenitor cell transplantation is a therapy that is beyond experimental fully feasible with an increasing number of experiences in the world, and it is the basis for future therapies applicable in patients with hematological and non-hematological disease, both benign and malignant. The different options of or variants with hematopoietic support as a transplant treatment vary according to the pathology and the conditions of the patients. Thank you.